These drugs may cause limited physical dependence or psychological dependence. Schedule 4 prescriptions may be refilled up to 5 times in 6 months. Verbal prescriptions are allowed. Common examples include alprazolam, lorazepam, diazepam, clonazepam. Benzodiazepines are used for anxiety, panic disorders, seizures, muscle spasms, alcohol withdrawal, insomnia. They should not be used in patients with severe respiratory depression, sleep apnea, acute narrow-angle glaucoma, history of substance abuse. With caution, benzodiazepines enhance the effect of GABA, the brain's main inhibitory neurotransmitter. This causes sedation, muscle relaxation, reduced anxiety. Side effects include drowsiness, dizziness, confusion, impaired coordination. Adverse effects include dependence tolerance, respiratory depression, especially with opioids or alcohol. Withdrawal symptoms if stopped abruptly. Tablets, oral solutions, injections, orally disintegrating tablets. Benzodiazepines don't directly activate GABA. They make GABA work better, like turning up the volume. Common examples include zolpidem, esopiclone, zaleplon. These drugs are used for insomnia. Contraindications include severe liver impairment, history of complex sleep behaviors, use with alcohol or other sedatives. They bind to GABA-A receptors, similar to benzodiazepines, but are more selective for sleep. Side effects include drowsiness, dizziness, headache. Adverse effects include sleepwalking, sleep, driving, memory impairment, dependence. Tablets, extended release tablets. These are called Z drugs because nearly all of them start with the letter Z. Tramadol is used for moderate pain. Contraindications include severe respiratory depression, acute intoxication with alcohol, or CNS depressants, children under certain age restrictions. Tramadol weakly binds to mu-opioid receptors, inhibits reuptake of serotonin and norepinephrine. Side effects include nausea, dizziness, constipation, drowsiness. Adverse effects include seizures, serotonin syndrome, dependence. Immediate release tablets, extended release tablets. Tramadol is an opioid, but it's weaker than Schedule II opioids, which is why it's Schedule IV. Used for short-term muscle pain and spasms. Contraindications include acute intermittent porphyria, history of substance abuse, use with other CNS depressants. It works through central nervous system depression, causing muscle relaxation. Side effects include drowsiness, dizziness, headache. Adverse effects include dependence withdrawal, abuse potential. Oral tablets. Carisoprodol is metabolized into meprobamate, an older sedative with abuse potential. These are used for neuropathic pain seizures, fibromyalgia, anxiety. Off-label. Contraindications include severe renal impairment, dose adjustment required, history of misuse. Caution advised. They reduce nerve excitability by affecting calcium channels in the CNS. Side effects include drowsiness, dizziness, weight gain, peripheral edema. Adverse effects include dependence, CNS depression, withdrawal symptoms if stopped suddenly. Capsules, tablets, oral solutions. Pregabalin was one of the first drugs scheduled because of real-world misuse, not theory.